If you've been living with chronic pain, most doctors won't say this to you, but I will. You've tried the meds, the procedures, maybe even surgery, and nothing has worked. I'm about to tell you why. I'm Dr. Savir Rao, triple board certified in pain medicine, anesthesiology, and functional medicine. And after 20 years in pain management, treating over 20,000 patients across both traditional and functional medicine, I see what doctors never get to see. I can actually compare what works through both systems and what doesn't. I often end up seeing patients going to different doctors, trying different medications, getting different procedures, and then hitting a point where nothing seems to work. They think they've tried everything, but there's something else actually happening that they don't see. Today, I want to tell you what I've learned from both sides. And once you understand it, the way you look at your pain will shift completely. Pain management and pain resolution are two different things. Most people with chronic pain get treated for one, but they're told that's the only option there is. I am a pain physician and I understand how we got here. The things that cause chronic pain are usually very complicated. We need time to figure them out. We need resources we don't always have. So instead, we learn to turn the volume down on pain, and that became what we call good medicine. Pain management can sometimes become a holding pattern. You're trying to turn down the pain signal so you can actually function. You take meds, you get injections, you do the procedures, and all of that has great value and helps, but the goal may not be to fix what's actually wrong. The goal is to make the pain easier to live with while you keep going further. This approach leaves a huge gap between what patients actually need and what they get offered. Most people with chronic pain may not need to manage it forever. They need to fix it if possible. Pain management and pain resolution are going in completely different directions and need totally different plans to get there. Real recovery from chronic pain requires moving beyond pain management into investigation and root cause treatment. This means asking why the pain is happening in the first place, running deeper tests, and addressing what's actually wrong at the tissue and cellular level. I've treated over 20,000 people with chronic pain. The ones who recover are the ones who refuse to accept pain management as their final answer. Instead of asking how to live with pain, you start actually asking what's actually causing it. Instead of accepting medications and procedures as the endpoint, you dive deeper into looking at what's causing inflammation, what's wrong with your nutrition, where the tissue damage is actually coming from. But most doctors won't acknowledge that because they just haven't been trained to do so. The people who end up living with chronic pain are the ones who accept pain management as the best they can do. The way traditional medicine is built, there are reasons to focus on pain management. Insurance pays for certain treatments. There's risk in telling patients to try newer things that don't have mountains of evidence yet. So most doctors stay in what they know. The patients who tell me they've tried everything have actually only tried everything in one lane. Physical therapy while they're in pain, medications to reduce pain, procedures to block pain signals, injections to decrease inflammation in joints. All of this is very helpful. All of it works in one lane, but they've never looked at what's actually causing the problem. Why is there inflammation? Why are tissues breaking down? Why is their nervous system stuck, acting like there's danger all the time? What nutrition is missing? What movement patterns are making it worse? The questions simply never come up. I can tell in that first visit which way a patient is going to go. It has nothing to do with how long they've been in pain or how bad it is. The ones who get better stop asking how to live with it and start asking what's actually causing it. People who break free from chronic pain do something different. They ask for a second opinion. They ask for a doctor why the pain is actually happening. And when the doctor can't explain it, they look elsewhere. They find practitioners willing to investigate. They get tests that dig deeper. They change what they eat based on what the tests show. They cut out the things making inflammation worse. When you ask for real answers instead of settling for just management, when you deal with what's actually wrong, you will get better. But most doctors won't acknowledge what's really happening because of how they've been trained. If this is making sense, subscribe, because I'm going to keep talking about how to actually resolve things that the doctors usually just manage. You'll want to see what comes next. Someone can be stuck in chronic pain doing everything their doctor says and still think there's nothing else to try because nobody around them is saying, let's find out what's actually wrong. Let's run better tests. Let's understand why your body is locked in this state. Regular medical labs are designed to catch disease. Does something show up as broken? Does the patient have diabetes, a thyroid issue, something visible on an image? If the answer is no, the tests come back normal. and the patient hears their pain is a mystery. But more advanced functional tests show things that directly cause chronic pain, and when you actually address them, the pain can go away. The questions we need to ask: have you ever been tested for nutritional deficiencies? Do you know what your inflammation markers actually are? Do you know what food affects your inflammation? Have you looked into whether the tissues in your body could heal if they got the right support? Your standard pain management doctor may not ask these things. This is the gap between pain management and pain resolution. Your doctor isn't asking these questions because their model doesn't require them to, but your recovery depends on them. What's coming next? The real difference shows up in the people who actually get better. After 2 decades, the pattern is clear. The people who actually recover from chronic pain aren't the ones with just mild cases. They're the ones who won't let pain management be their final answer. Some of these patients use regenerative treatments like PRP or exosomes. Some use strong anti-inflammatory plans. Some use peptides. Some combine traditional physical therapy, interventional treatments with nutrition focused on function. The specific tools are different for different people, but one thing never changes. They said no to just managing pain. They pushed to understand the root cause. Stop accepting pain management as your final answer. Stop asking your doctor the questions pain management can't answer and then believing them when they say nothing else is possible. Stop thinking you've tried everything when you've only tried everything in one lane. Start asking for other opinions. Demand that someone actually investigate why the pain is happening and get tests that dig deeper than standard labs. If you're in chronic pain and doctors keep saying your choices are medications, maybe procedures, maybe surgery if it gets worse, you're inside the pain management world. That's an incomplete approach. It's like putting duct tape on a leak. It might work for a while, keeps the water off the floor, but if it doesn't fix the leak, and every time you patch without fixing, you're just delaying the conversation that would actually change things. You might have had chronic pain for 20 years or even 3 months. It doesn't matter. The question stays the same. Are you accepting pain management as your final answer, or are you willing to look deeper? The medical system is really good at managing pain. It's built for that. But people with chronic pain need more than just management. The ones who get better are the ones who demanded more and found someone willing to actually look. If you want to understand what kind of practice that actually looks like, why I left traditional medicine and built something completely different, that's the next video. I'll link right to it.